So how much of a risk is face-to-face instruction for K through 12 and universities?
7 Action News reporter Jennifer Ann Wilson spoke with the White House Coronavirus Task Force coordinator to get some answers. Jennifer Ann?
Yeah, so what she was saying is that it's not necessarily about the exact numbers because Michigan is doing better when compared with some of the other states, but it's about the trend. And right now, Michigan's case numbers are trending upward, and that could be because some people have been traveling to other regions and to other states, and they may be bringing the virus back with them.
And what we can all do together to ensure that universities can open safely and schools also is decrease the community spread and ensure we're being vigilant in every single location.
Dr. Deborah Birx is the coordinator for the White House Coronavirus Task Force. She says everyone in the state is responsible for helping kids get back to school. And the biggest concern she has for increased spread is when students from different cities or regions come into close contact.
And every university that has large number of students coming back and living in dormitories where we know there has been spread previously, every university needs to have a plan not only for routinely testing the students, but what would happen if you had an outbreak and how many students you would be able to test.
Speaking of tests, the White House COVID Task Force is working with governors and local health officials to ensure the case number data so many decisions are based on is reliable.
You really need to deduplicate. You really need to pull out these multiple test positives.
And what about the tests themselves? Detroit Lions' Matthew Stafford is one of several high-profile people who received a false positive COVID test, creating a lot of uncertainty and mistrust. Dr. Birx says a false positive test is rare. Tests shown to be unreliable aren't being widely used.
So Americans should understand that our testing, because of what the FDA did and how hard they worked to really assure the quality of those tests, we don't have the level of concern about testing false positives and false negatives that many other countries have that didn't have the same level of control and oversight of their testing.
I asked Dr. Birx just how soon, realistically, we might have a vaccine that could get into the hands of the general public. And at this point, she can't give me an exact number, although she says the testing of the existing vaccines is going well, and they're hoping to at least begin giving them to those who are at the highest risk at the end of spring next year. But at this point, there are still a lot of questions about just how long that vaccine will last and how quickly they'll be able to produce them. Reporting live, I'm Jennifer Ann Wilson, 7 Action News.
So important for those kids who are going back to face-to-face learning to make sure that they are protected and, of course, that they are getting tested. And we know a lot of people right now are waiting for that vaccine. Jennifer Ann, thanks for that live report.